name is Julia Ostropolsky. I was born and raised in Kiev, Ukraine. I came to the United States when I was 17 years old. When I was growing up, my parents were what is called refuseniks. They were Jewish people who were refused to come to the United States or to Israel to leave the Soviet Union, and they were fighting for their rights, for their civil rights and freedoms. And growing up, very frequently I watched my parents get threatened with prison, and it was a very difficult experience for a child. And I had to learn to be quiet at school about certain things and not share that my grandfather was listening to BBC that was forbidden. And Bilingual International Assistance Services was born in 2002. The agency began serving the Russian-speaking. A year later, we expanded to the Bosnian community, and having been from similar cultures, we're able to assess the community needs and focus on the needs of the seniors. We also expanded to other communities, and today we're able to speak 40+ languages. We have 18 staff members, all of whom, or majority of whom, are bilingual, and we serve seniors from every racial and ethnic minority. We take very proactive role in addressing social issues in America. One of the things that we're very proud of is assisting people in becoming United States citizens. We teach them, we tutor them to prepare for a very tedious, very difficult exam. We help them learn history and U.S. civics and basic English. And these people vote, these people become members of society. We advocate for people who are turned away for wrong reasons or denied services based on their inability to speak the language. We see ourselves as voices for those who cannot sometimes speak for themselves. And so being bilingual helps in ensuring that individuals are awarded equal access to services that otherwise would be unavailable to them. On the annual basis, we serve anywhere from 25 to 3,200 people. 2 years ago, when we provided first-year Affordable Care Act assistance, we served 7,600 people, and individuals are served through 6 of our major programs: mental health, social services, senior center, interpretation and translation, immigration naturalization services, and education and advocacy. Most recently, we started serving kids and also adults, as I had mentioned, through the Affordable Care Act. In serving refugees and in serving minorities, I think the most challenging is making sure that no person is left without service because their language is a minority language within minority populations. And it becomes a very big challenge when you provide services to a community of 20 as well as a community of 20,000. And I think that one thing that needs to be recognized is appreciation for bilingual workers, appreciation for interpreters, because very frequently providers don't allocate enough funds to ensure interpretation. And yet, one of the things that I focus on when I advocate and provide cultural trainings is that people would come to the providers and would seek services if they knew that support were there. So one of the largest challenges is making sure that equal access is awarded to all, regardless of how many are in that community and regardless of the language they speak, and that they too feel like they belong.